No, central sensitisation can change quickly. Whilst chronicity leads to central sensitisation, just because central sensitisation has been there for a long time, it doesn't mean to say that it's going to take a long time to change. Just take the medication, for example, the triptans. The triptans, heavy-duty anti-migraine medication, developed specifically for migraine, abort migraine, cluster headache, tension-type headache, menstrual migraine by desensitising the brainstem, and they do this literally within less than an hour. So from a medication perspective, central sensitisation can change very, very quickly. Now, in a case study with a patient who was experiencing SUNCT, that is short-lasting unilateral neuralgiform headache attacks with conjunctival tearing. Now, SUNCT presents in a very similar way to cluster headache. And in cluster headache, there are short, sharp bursts of pain and then no pain occurring in clusters. And what this patient demonstrated was brush allodynia. And of course, brush allodynia is a sign of central sensitisation. And what they demonstrated was that brush allodynia was present during the attack, lasting 3 or 4 minutes, and then absent minutes later outside of an attack. This demonstrates that central sensitisation can change very quickly. Now, I mentioned earlier that when treating headache, I sustain techniques in terms of reproduction and resolution of headache. And I started sustaining for all the wrong reasons. I thought that what I needed to achieve was remodelling of collagen and elastin fibres. But I'm told it takes 100 hours to stretch collagen. So clearly this is not the effect that is responsible for resolution of head pain as a technique is sustained, because head pain resolves literally within 30 seconds, 50 seconds, 70 seconds or so. So there has to be something else that's happening here. And I was suspicious that we were having a desensitising effect, because what some patients would say, coming in to be examined, treated in a headache-free state, they would say, well, Dean, I'm always tender to touch, and I'll touch a certain area of their head. So what I'll do then is to lay them down and I reproduce the pain of the headache and wait for resolution to occur. And then I'll do it again and again and again. And with each subsequent hold, what's happening is that the reproduced pain is less severe and it's easing more quickly. And after 4 or 5 holds, I'll then get them to sit up and I'll say, now, can you touch your head again? Find that tender area. And they can't. So allodynia, a sign of central sensitisation, changes very quickly, literally within a matter of 4 or 5 minutes. So I was suspicious that we were having a desensitising effect, that reproduction and resolution of head pain desensitised the brainstem. And this in fact was the subject of my PhD research. What we did was we took a group of migraineurs in whom we could reproduce the pain of headache, and we measured the activity in the brainstem as I reproduced the pain of headache and achieved resolution. And we measured the activity in the brainstem using the nociceptive blink reflex. And over 4 90-second holds, what we demonstrated was, well, firstly, that there was significant reduction in the reproduced head pain across the 4 holds, but this was nothing new. This is what happens clinically. But the behaviour of the nociceptive blink reflex changed in a way that demonstrated that we were having a desensitising effect on the brainstem. So the latency of the nociceptive blink reflex increased. The amplitude of the nociceptive blink reflex decreased. Both these modifications of the blink reflex indicated that reproduction and resolution of typical head pain in migraineurs desensitises the brainstem. Central sensitisation can change very quickly.